The Medical Workers Union now says the health crisis across the country has deepened after the Council of Governors attempted to downplay the crisis when it appeared before the National Assembly on Wednesday. The Council of Governors Health Committee Chairman Jack Ranguma said that workers had no reason to strike, but the Kenya Medical Practitioners, Pharmacists and Dentists Board says that the crisis will persist unless an independent health workers commission is created to look into the workers' welfare.
We as Medic are having a major problem, and I'll just give you a few examples. One, you're having delayed salaries. In some cases, they're not paid at all. Two, you're having two counties neighboring each other. One is paying full salary, the other one is paying a half. These are trained health workers with the same training, the same environment, are treating the same patients. One is getting half salary here, the other one is getting a full salary there. The other thing is to do with promotions. You're having officers working in one job group for more than 5 years. Now, if you go to the counties, they tell you that when they took charge, some of these things they should have done with the national government. You go to the national government, they tell you health is fully devolved. So any query, you should address it at the county level. Okay. The other challenge you're having is training. In the counties, they have listed their priority in terms of the things that you want to train in. Now that is so limiting in terms of one's career progression. If you want to do, let's say, dermatology, diseases or whatsoever, there are more priority courses that you need you to do. Okay, not knowing that while you are limiting this person's progression, County B might also need this particular service because they're working with the same people. Okay. And so many other things that comes with the devolution, and that's why we are asking as medics that let's have a centralized way of doing these things. Okay. While you might have few gains here and there in terms of devolution, the serious challenge that comes with human resource will mask and overshadow all these gains that is anticipated. And so let's have a centralized body. As medics, we are proposing a health service commission. This one will handle all this aspect together. Right now, if you want to transfer in this country as a medic, is a nightmare. This is not only breaking families, but it also limits both horizontal and vertical progression. Because if you're working in Mandera and you have to get a transfer to Kisumu, for example, is a nightmare. There are so many bodies, there are so many processes that you have to go through. And that is so limiting. An officer should work in a given area. When the time of transferring to a given location is concerned, it should be an easy process because all of us cannot work in the same area for a given period of time. Then the other thing is the medics are few. So we need to serve all Kenyans, and that's why we're supposed to get room to get easy transfers.